Good afternoon, everyone. On behalf of AAUW, my name is Sherry Ebiam. I'd like to thank you for coming to this forum on this gorgeous afternoon, so it's definitely a sign of your commitment, and to avail yourselves of the opportunity to hear from our panelists, to hear their thoughts, experiences, information as they relate to Measure B. I would just like to give a brief introduction of our panelists. Our first speaker, it will be Emily Ockey, who is a youth advocate here in Willits, and she will be followed by Tom Allman, our Mendocino County Sheriff. Next to Tom is Margie Handley, who is a member of the Mendocino County Behavioral Health Advisory Board. That's a mouthful. Which formerly was called the Mental Health Advisory Board, but now has a broader umbrella under its auspice, and that name, behavioral health, reflects that. Next to Margie is Gary Williams, who is a local art educator.
Gary Martin.
Oh, I got the last names wrong, sorry. Gary Martin, a local art educator. Next to Gary is Jacque Williams, who is the executive director of the Ford Street Project. I'd also like to announce that in the back, Linda Posner will be at the table. So if you haven't already, you can register to vote. There are forms in both English and Spanish. So without any further ado, I would like to turn it over to Emily.
Thank you. Thanks, Sherry. Hi, I'm Emily Ockey, and I live in Willits, and I have some information to share with you about Measure B. There's an overwhelming and impactful need in Mendocino County for a mental health and recovery services facility and training center. According to the CDC, 25% of all U.S. adults have a mental illness, and 50% of adults will develop at least one mental illness during their lifetime. Between 1995 and 2014, the number of psychiatric care facilities has been reduced by more than 24% in California. The number of beds available has been reduced by almost 30%, and the California population increased by more than 22%. For every 5,886 Californians, there is one psychiatric bed. In my experience working as a treatment facility counselor, educational coordinator, and assistant program director, clients often receive psychiatric facility intervention prior to entering a residential treatment setting and at intervals of acute crisis. Such services were invaluable to provide safety and stability. Within the appropriate level of containment, clients were able to de-escalate, better access treatments available, and better participate in the recovery process. There's a wide spectrum of health and behavioral conditions and traumatic events that can affect a person's mental health, including substance abuse and other addictions, as well as chronic medical conditions. Laura Welter, Executive Director at Safe Passage Family Resource Center in Fort Bragg, says, addiction can result from people's attempt to self-treat a mental health problem. They often evolve simultaneously, and a behavioral health crisis may lead to homelessness. People who have mental health issues and substance abuse disorders and who are homeless are more likely to have immediate life-threatening physical illnesses, and more than 10% of people who seek substance abuse or mental health treatment in our public health system are homeless. Mendocino County Health and Human Services Agency Homeless Survey of January 2017 counts over 1,200 homeless individuals and families, mostly unsheltered in our county. According to the CDC, people with disabilities are often at greater risk for mental health problems. And persons with any type of disability are 2 to 4 times more likely to experience substance abuse issues than those without. The U.S. Census Bureau reports 12% of people under 65 in Mendocino County have one or more disabilities, including my son. Due to lack of county services, mental health or substance abuse-related crisis situations drain local law enforcement and emergency room resources, negatively impacting the quality of life in our community. In the words of Ukiah City Police, mentally ill patients in crisis are transported to local hospital emergency rooms. While police officers are managing mental health crises, the department's ability to respond to other calls for police services drops significantly. The need for additional crisis intervention resources and secure supervision of mental health patients is urgent and significant. They have not been able to address many quality of life nuisance issues that impact our community. Significant percentages of jail inmates have substance abuse issues and/or unaddressed mental health needs, and once involved with the criminal justice system become less likely to get treatment and more likely to become repeat offenders. The Northern California law enforcement responses to the National Drug Threat Survey of 2011 identifies methamphetamine as the greatest drug threat, most contributes to property crime, and most contributes to violent crime in Mendocino County. Sheriff Allman, who will speak soon, in 2013 counted methamphetamine-related arrests at nearly 1 a day. In 2012, the U.S. Arrestee Drug Abuse Monitoring Annual Report, ADAM 2, counts more than 50% of adult males arrested tested positive for at least one illegal drug. The Bureau of Justice Statistics counts 53% of jail inmates suffered from drug use, abuse, or dependence, and only 7% received treatment. 63% of males and 75% of females in jail are reported to have mental health problems, yet 1 in 6 are treated. Nearly 25% of jail inmates who had a mental health problem served 3 or more prior incarcerations. Mendocino County population is approximately 87,500 people. The need in our county is increasing faster than in urban areas where greater resources exist for mental health and substance abuse treatment. The number of people reported as receiving treatment is far below the number of people reported in need. California Department of Public Health tracked the suicide rate 2003 to 2013 in rural California counties increased by 23%. The rate rose twice as fast as the increase in urban counties. The rate exceeded the urban county area rate by 80%. UCLA Census Snapshot reflects Mendocino County has one of the highest LGBTQ populations in California and the U.S. at 3.7%. Over 40% of LGBTQ students have seriously considered suicide. Almost 29% reported suicide attempts. SAMHSA, the Substance Abuse Mental Health Services Administration, reports nearly 4% of Mendocino County residents have serious thoughts of suicide. SAMHSA identifies several underserved populations in Mendocino County from the county level annual averages of 2012, 2013, and 2014, including needing but not receiving treatment for illicit drug use, as high as 4%. Needing but not receiving treatment for alcohol use, as high as 7%. Underserved populations, according to CDC and SAMHSA, report county-level prevalence of, quote, frequent mental distress among adults was reportedly as high as 10% of the Mendocino County population. That's 8,750 people. Mental health clients served in 2015 by Mendocino County Behavioral Health and Recovery Services was 1,945 people. That's 2% of our population. And substance use disorders treatment served 257 individuals. That's 0.3% of our population. From Mendocino County Specialty Mental Health Services mission statement, 2 excerpts highlight areas where we have been remiss in our commitment. Mental health services strives to deliver services in the least restrictive, most accessible environment and improve quality of life through community-based treatment. Sending patients out of county is inarguably neither least restrictive nor most accessible. I assert that we have been negligent in our responsibility to deliver community-based treatment. Until we rectify this discrepancy, we are complicit in the consequences. In conclusion, it is imperative that Mendocino County address the treatment needs of the residents locally, accessibly, and within our own community, with essential quality care training facilities, Revenue allocated to fund this endeavor is an investment in the betterment of the individual lives and the community as a whole. I thank you for affirming our community by affirming Measure B.
Good afternoon, and thank you. Thank you very much for being here. There's actually other things you could be doing. I know you haven't thought of that. But talking about Measure B and talking about mental health, right now, right here, is the absolute best thing that we as responsible citizens can do. Mendocino, let me give you a quick chronological order of how we got to where we're at. This is a bipartisan blame ship right here, okay? Governor Pat Brown in the late 60s suggested that we start closing state mental hospitals. We had over 40,000 beds at that point in the state. Our population was 19 million. When Governor Reagan took over, he certainly could have stopped it, but he not only continued it, there was a slight increase. So there's bipartisan blameship. Continuing on to 1999, when the Board of Supervisors made a huge mistake to close the only mental health facility we had in our county, the Psychiatric Health Facility, PHF. If you've heard people talk about the PUF unit, that was a PUF unit. And the PUF unit was here in Mendocino County, in the County Admin Center, and this was a location where people, our citizens, could go for that 72 hours to just decompress. After they had been 5150, endangered themselves, a danger to others, or gravely disabled. If a physician has deemed them to be 5150, or law enforcement or medical personnel, they are taken to the PUF unit, and that's where their families could see them. They could see local doctors. They could get on local medication treatment if that's what the doctor preferred, and then they would be put back into our community. But in 1999, the Board of Supervisors said we're going to close it in the spring of 2000, and there it was closed. Now, please don't think that because it was closed in 2000, we've seen any reduction in the number of mental health patients in our county. We haven't. We've certainly seen an increase. So what I'm telling you is since 1999, 100% of the people, of our citizens, of our neighbors, of our family members who have been 5150'd, they're put into a car and they're sent out of county. Yuba County, Shasta County, Sacramento County, Solana County, Sonoma County, and it's not just them that's sent there, but our tax dollars. Our tax dollars are paying for them to go to an out-of-county location where they're going to be treated by doctors that they may never see again, by nurses they may never see again. They're going to have one set of clothes for 3 days. They're not going to have their own clothes. It's not a situation that we're saying is the right step to go towards recovery. So now here we are in 2017. Mendocino County, in my opinion, has made 3 grave mistakes in our history. We gave away our water to Sonoma County in the 50s. Okay, we didn't buy for $1 the state mental hospital on Talmadge, and we closed the psychiatric health facility. Well, there's nothing I can do about the water. There's nothing I can do about the state hospital. It's already belongs to a university. But we can make a difference here. We can get a full mental health program back up and running, and we can have our people treated locally. You're not hearing me as sheriff saying, I need more deputies, I need more patrol cars, I need more stations. What I'm asking for is I would like for my deputy sheriffs to actually get out of the 100% mental health response unit and investigate crimes and improve the quality of life in our neighborhoods. And as I've said many times, if your house is on fire, don't call a plumber. Okay, if your house is on fire, call a fireman. And if someone's having the most serious psychotic breakdown they've ever had in their life, I'm here to tell you that sending in a 21-year-old deputy with a gun and a badge may not be the perfect solution. It's a solution because society has changed the paradigm of what a mental health response is. And we just assuming that, well, since law enforcement's out there 24/7, let them be that first contact to someone who's having that psychotic episode. Well, let's talk about recovery. Let's pass Measure B. Measure B, real quickly, is for 5 years. It's a half-cent sales tax that is going to generate $28 million. Of that $28 million, 75%, or $21 million, will be used to develop facilities throughout Mendocino County. This is not the county of Ukiah. It's the county of Mendocino, so we need to understand that we have populations on the coast as well as North County as well as Ukiah. And then an eighth of a cent, so 25% of that, $7 million will be used immediately to provide resources and services immediately. So after 5 years, that half-cent sales tax changes. It just continues on at eighth of a cent, and it'll continue on to perpetuity until the voters say we don't need that anymore. So let me tell you what an eighth of a cent is. For every $100 you spend, it's 12.5 cents is what it is. And this 12.5 cents, an eighth of a cent, will generate $1.7 million that will be used in addition to what the current mental health budget is. So we're going to be able to have, in my opinion, premier mental health services 24/7 to where our people are going to be treated here, and there's actually going to be some kind of recovery process. God forbid, we want to reduce recidivism of mental health. Our society is so gung-ho to reduce recidivism of the criminal element that we're losing sight of the fact that the mental health element is something that if we don't start working on reducing that recidivism, we will never get our grasp on the criminal element. We really won't. Because we are to a situation right now where there are people who are so frustrated over the mental health, and I'm not saying bad things about Redwood Quality Management. I'm not saying that at all. They're actually much better than the other contractor that was here. Ortner's a four-letter word in my opinion. Redwood Quality is doing a good job, and if you're not up to not aware of what I'm talking about after this, I'll please explain it to you and tell you where we are, because Redwood Quality is delivering good service, but there's only so much they can do with what they have. If we continued on this road without having a psychiatric health facility in our county, all we're doing is repeating our bad luck year after year after year, and we're going to get to the point where we're going to be way behind the eight ball. So, while I certainly appreciate the statistics, let me bring it home on suicide right now. We live in the most beautiful county in the state, yet per capita, we are 11th in suicides. Wow. I'm the coroner. Every one of those suicides crosses my desk. In 2005, my brother took his life in Humboldt County. I certainly know the impact that suicides have on the family, certainly on the individual, the family, the community, the workplace, the schools, the hospitals. Suicide is just devastating. And we have to understand that this isn't money that we're going to pay just because we want to feel good about people. This is a quality of life issue. Mental health affects our entire county at every level. This is not a homeless situation. This is not just a mental health situation. This is a quality of life for every individual that lives in our county. Now, some people have said, well, gosh, this is going to cure our homeless situation. No, it's not. Homeless situation is a trend that certainly happened throughout our nation, but let's talk about it. There certainly are people who are mentally ill and homeless, but that doesn't mean that most mentally ill people are homeless or that most homeless people are mentally ill. In my opinion, I think there's a 30% segment that both groups combine, and there is a 30% segment of people who are mentally ill and homeless. And will this help them? Of course it will help them. It will improve people who are wandering the streets that really and truly just need some direction, that our county, we don't have the health unit, the mental health unit, to give them the help. So as sheriff, I want to allow my deputy sheriffs to continue on and doing what they're doing, but not be that absolute first responder, but we want to work. I'm not saying in any way that their sheriff's offices wants to step away from mental health, but the chief of police and the chief of police of Ukiah and I, in March and April, we had our dispatchers do a 30-second survey on every mental health call that came in on 911. And what our goal was is to find out what kind of calls are coming in. What we found was 30% of every 911 mental health call involved no weapon, no violence, and no imminent threat. Somebody was calling 911 because they just needed help right then, and we as government were sending the most expensive government employee we had, the deputy sheriff or a police officer, we were sending them to take care of this. Since in 26 months ago, so in 2015 it started, in Mendocino County we started a unit called MOPS, Mobile Outreach Preventative Services. Please help me with a better acronym, but that's all we have right now. Mobile Outreach Preventative Services. that for 26 months, we have been sending an unarmed sheriff's office employee and a mental health employee to Covelo and to the South Coast, and they're knocking on doors of people who have been frequent flyers of the mental health system. They're knocking on the doors and saying, have you eaten? Have you taken your medicine? Have you talked to your family? Are you okay? Is your house hot? Is your house cold? Are you wearing clean clothes? Things that you and I may take for granted. And what we're seeing, with one exception in 26 months, we've had one person that the family has called 911 on, but the rest of them are no longer calling 911. And a Measure B is going to allow us to expand this throughout the whole county, because I'm telling you, law enforcement is not the answer to every problem. You know, if law enforcement is the answer, I didn't hear the question. That's the wrong question. So Carol's telling me I'm out of time. I'd love to talk to you afterwards. I'm going to hang out here afterwards. If you have specific questions that are not answered up here and you don't want to talk on the microphone when we're all done, just hit us up. Okay, thank you.
When I was 20 years old, my baby died, and I became an emotional basket case. I would laugh when nothing was funny, I would cry when I didn't need to, and it was always at the most inappropriate time. And I realized that I needed help. But my husband was a logger, and we didn't have any money, and we certainly didn't have any money for a psychiatrist. So I went to my mother, and I said, Mom, I really need help. I need to go to a psychiatrist. And I'll never forget what she said. She said, Margie, you're not going to any psychiatrist. And I said, why? And she said, because it would be a taint on the family name. And it's hard to believe, but we haven't come a lot further in 60 years because people don't want to talk about mental health. And even our behavioral health board, it's hard to say and hard to spell. We don't want to call it mental health anymore. Now somebody somewhere decided behavioral health is more politically correct. But we need to start facing the fact that mental health is no different than physical health. And, you know, I'm an old person, so I can say this. Just talk to an old person. They'll tell you about their knee replacement, their hip replacement, all the medicine they're taking, who they went to the doctor with, and they love to tell you. But they'll never talk about depression or suicidal thoughts or dementia. They don't talk about that because it's still not acceptable. And I think that we have to get through this so that it's just another illness. It's not, there's nothing wrong with it. There's no shame in going to a psychiatrist. There's no, you should be happy to do it so you can get help. Okay, the fact is 1 in 4 people has a mental health issue. So that means there's 60 people in this room. 15 of us have a problem. And it's really true. I mean, if you look around, there's always somebody that's either in treatment or needs treatment or wants treatment, but they don't know where to go. A lot of times they don't know where to go. And Avenues to Wellness had a speaker series last month, and we had about 100 people there. And the questions all revolved around, where do we go for help? We don't know where to go. And quite frankly, there's lots of resources in Mendocino County. There actually are, except for the 5150s and the crisis. But there are places to go to get help here. And so all you have to do is call the mental health people, or Manzanita's here in the Methodist Church across the street. You can get a directory there. But I think we should commend the sheriff because, sometimes when you try to do something and it doesn't work out, you quit. You say, well, it didn't work, so I can't do it. Tom doesn't give up because he sees this every single day, and he knows that we need to do this. So he came up with a nice committee and a better solution to the problem. I think now that there's money for staffing, I really feel confident that this initiative is going to pass. But we have to get out and vote. And the fact that there was no written opposition against it tells me that it's the right thing to do. And I think that every one of us has to, there's nothing else on the ballot. So that means most people aren't going to even bother. So it's up to every person in this room to get their friends, send in your absentee ballots, put out signs, do whatever you can. But it's really critical that we get this to pass. So thank you.
Thank you, Margie. My name is Gary Martin. I'm never quite sure where to begin these things or not. I've always been gay. I'm an alcoholic. I'm 37 years sober. I'm mildly dyslexic. I'm obsessive compulsive to a fault. And I'm bipolar on top of all of that. I think my mother had a very good time while she was pregnant with me. Anyway, I beat the odds. I'm 67 years old and I'm still here. Yeah, so that's not bad. Well, it's a pretty big deal for me, as I've been through most of my life without a diagnosis. It wasn't until I was the age of 50 that I was diagnosed as being obsessive compulsive and dyslexic and bipolar. All my life I had worked around these things. Of course, I tried to self-medicate at first with the illnesses and drank alcohol, lots and lots of alcohol. It was disgusting. When I was 31 and I looked like I must have been 80 years old. I had blood veins in my nose. I mean, I smelled like vodka. It was terrible. It was terrible. And I almost threw myself in front of a bus because I didn't know what to do. And finally, what happened was I finally figured it out. I was doing things the wrong way. I was doing things my way, not the right way. My way wasn't always the right way. So that's what got me to change there. When I was 50 and diagnosed, I had actually had a mental breakdown. It was getting to be too much. I'd moved 3 times in 3 years, and it was just a bit much. So I kind of went to pieces over that, and that's when I found out that I was mentally ill. And I'd always thought I was crazy, but mentally ill was a different thing. That means you're really crazy. So that's where I ended up. Talking about psychiatry and talking about my being bipolar and obsessive compulsive has never been a problem. One friend when I called her and I told her that I was bipolar, she said, well, that explains a lot. And I've been able to hang on to friends for years, which has been marvelous, and they've all come through this with me, with flying colors, so to speak. Haven't lost any friends because of it, which is wonderful, too. It's only endeared me more to people, I think. Medications are difficult, dangerous, things like that. When you have a mental illness, take your medication. Take your medication. I hear from a lot of people, who tell me, they're a family member or a friend is bipolar, or they have a mental condition or whatever. Are they taking their medication? No, they're not. They don't think they need it. Some people take medication, they start to feel better, which you will if you're taking the correct medications anyway. And they start feeling better, they stop taking them, and they immediately fall into old habits. I never want to go back to the type of depression that I had, whatever type it was, because it almost cost me my life. So no more of that. I take my medication, I'm steady, I'm fluid with what I do. I run a pretty straight course nowadays. I keep very busy, very active, and I can manage a lot of different things where without my medications, without my medications, I'd be nowhere. I'd probably be dead. That's what it would be, because I really don't know how I could bear life without them. Feeling the way I did before anyway, and falling into the mass depressions and cycling through mania and depression. Mania, by the way, is a great thing. Mania I love. You actually get a buzz from it. So one of the medications that I do, though, tones that down a bit. So if I have a big project to do, I kind of lay off that med for the day, get a lot more done that way. Not good to mess around, but after 17 years, I figure I can, skip one every now and then and do something along that line. I don't know what else to say. I want these facilities in Mendocino County. We need these facilities. I had a session several years ago, and I called a suicide hotline, and I went over and talked to them, and they let me out. They let me go. They shouldn't have let me go. I was at 50-51. I knew it. I was going in on it. Didn't necessarily tell them. But, and I got out of there the same day. I wasn't issued to, order to go to a hospital or anything like that. I didn't want to. I wasn't able to take care of it myself. The little bit of intervention that I had helped. The little bit. Didn't help a lot, but it helped. What we really need true intervention into problems like mine. I'm being selfish when I say this. I want this facility here. I believe we need this facility here. I'm one person. I'm a success story, I think. A lot of people are not success stories. A lot of people don't have the opportunity to be a success story. So let's give them this Measure B. Let's get this Measure B going. Let's get these necessary facilities for people who really need them. Thank you.
Can you hear me? Good. I want to take a minute to tell you about Ford Street, just because I think it's important that I'm going to talk to you about what my perceptions are in our community, and it's kind of important that you know the window I'm looking through or the filter I'm looking through. Ford Street started in the mid-'70s, and it was an alcohol and drug program mainly for men, mainly men's groups. And it grew over time, and today we have a residential treatment facility that people come and are looking for addiction support. The two largest groups of people that come, or the two largest contracts that we have, are vets and parolees. And both of those populations come with comparable issues around addiction, but most of those populations, the guys are experiencing some mental health barrier as well. So I don't think we could be effective and help people with their addiction recovery without paying real close attention to behavioral health issues or mental health. For some folks, it's so interchangeable, they're still trying to piece it out themselves. The other thing we do at Ford Street is we try and help homeless families. And we have right now 12 apartments where we provide transitional housing for homeless families. And a lot of these, most of them are single moms with kids. We have a few dads, but mostly it's single moms with kids, and many of them are very young. And many of them, after they get kind of out of their fear place and realize they have a safe place to raise their kids and a safe place to sleep at night, and we build rapport with us or our care managers, they'll tell us that they're worried. And half of them have an anxiety disorder, depression, but they don't know. They don't really know or have the context to even know how to ask for help. They've been afraid that if they say they have a barrier, they'll lose their kids, right? So I feel like the heart of Ford Street is around helping people where they are and figuring out kind of where they'd like to be or what that next space might look like. And I'm very pleased to report that in our community, we understand that bouncing people around for services can really do harm. And I feel like the different providers have really figured out how to do that graciously. And that's one of the main reasons I want the services locally. I can call Wind at Manzanita and say, I need help. I can call Camille. I've got a person and I need help. When I call somebody in a facility out of this county, I feel like I'm talking to the wall. They don't understand, they don't have the same value set we do about our neighbors, and it's just more difficult. The other thing that happens, because there are occasions where we have people in treatment that have been taken to out-of-county facilities for 7 to 10 days and come back, they're somewhat traumatized when they get back. It's almost like, whoa, what happened? And you do kind of have to give them that time to settle in and regroup. And I'm just imagining that if we had those local services, that would be minimized. So, several of you have said you're being selfish. Me too. I think it's time we get real selfish for the people we care about and think about what's best for them. Now, years ago, Ford Street operated the Buddy Eller Shelter. And there's, as Sheriff Allman expressed, there's always information and kind of conflicting views about homelessness and mental health barriers and all that. And I thought, maybe I'll just give you some information about that shelter. What happened the last 5 years in that shelter in Ukiah? Because I think sometimes hearing the national averages and the other numbers don't mean as much as listening to what happened in Ukiah. So the last 5 years we operated that shelter, we served 3,000, a little over 3,000 unduplicated folks. And yes. Okay, let's see, how can I do this? If you come more than one time, I'm not going to count that, right? So some of the myths that are out there is that there are people that come to shelters and they just want to stay in a shelter and then they move to another shelter and they never avail themselves of services and they don't get better. In that last 5 years that the Buddy Eller shelter was open, of those 3,000 people, 1,900 came and stayed one time. Now, I don't know where they all went, but they didn't come back, and they could have in 6 months. You know, you can stay in a shelter for 6 months, but in a 12-month period. So I think there are people that did come back as soon as the clock allowed them to. It was 4% of that number. So there is that out there, but it's a very small number of people. And so I've always believed that we all do better when we all do better. And so creating these little circles of people that you will help or you can help or we shouldn't help doesn't really help. And so when you look at who was homeless and who we were able to help, some of the people in the shelter, 54% at intake told us they had a mental health barrier. And so that's self-reported. So a lot of folks would say, no, I don't. I don't have any physical disabilities or any mental health issues. But then we would make them tell us if they're on medication, and then they would list all their mental health medicine. And then we'd say, okay, let's go back to that other question about do you have a mental health barrier? So, it is true we are reticent to admit those things. There's still that stigma out there. So I believe that appropriate, timely mental health services will break some cycles. I really do. And I think that will change some people's lives. Some of the things that we've learned at Ford Street is we allow people to stay in our clean and sober housing after treatment longer than we used to because they ask for it. And some of the reasons they ask for it is if they're going through a new change in their medication or they're going through a significant life event like the loss of a partner or the loss of a parent. They just want a safe place to settle in and stay a wee bit longer until they feel comfortable. So, again, you don't get those options when you send people out of county. Those are the accommodations we make for one another because we care about one another and we care about the people we serve in the county. So I love the idea and ask for your support for Measure B because I think you really do have a network in the community that's trying really hard, a little bit more investment, and we could really take it to the next step.
Thank you, all of you.